acute mental health patients being discharged without plans, sometimes to caravan parks, report. Health Minister Jonathan Coleman has welcomed the Auditor General's report into acute mental health discharges. But he said it was a snapshot of 14 months ago, much had changed and would be changing to improve care. Acute mental health patients are being discharged without plans, sometimes without a home to go to, and often without their family's knowledge, a scathing new report has found. An investigation carried out by the Office of the Auditor General, OAG, has unearthed startling new details, painting the picture of an acute mental health service struggling to do the best with what it has. But it was often not good enough and patients were being put in danger, said the report tabled in Parliament on Wednesday from Deputy Controller and Auditor General Greg Scolum. Sign up to get politically correct, Stuff's Politics newsletter. Focused specifically on the planning that was carried out before a patient was discharged from hospital, the report found most people had at least a partial plan. However, many left hospital care with no plan at all. A plan included suitable accommodation, a financial and support plan and details for what to do if arrangements broke down. People could be discharged with no formal handover to the community mental health team. Families were sometimes kept out of the loop by the arrangement of inflexible planning meetings while they were at work, and when they were involved, they often reported not feeling listened to. A lack of suitable accommodation in some situations had meant vulnerable patients were being discharged to caravan parks as a workaround, or kept in hospital longer than required. The quality of discharge planning went down whenever there was high demand for beds, and it often failed to cover a patient's broader needs. There was confusion between DHBs about whether it was appropriate to share a discharge plan with patients at all. While most DHBs expected patients would receive a copy of their discharge plan, OAG staff were told in interviews that this was often not the case, and sometimes plans weren't shared with community mental health teams. Practice in this area was generally poor. Some of the reasons we were given for not providing copies of discharge plans to patients and their families included, patients needed to make formal requests, it is illegal, it would upset, distress patients to read it, or they would leave it lying around, the report said. All DHBs consistently failed to meet the follow-up target of 90% of patients receiving follow-up contact within 7 days of being discharged. DHBs managed to follow up with only 2/3 of people within 7 days. Community-based care and follow-ups after a patient had been discharged was critical to lowering the risk of hospital readmission. Figures detailed in the report showed that almost half of all readmissions occurred within 9 days of discharge, and 3/4 within 17 days. In other words, most readmissions occurred well before 28 days had passed. The spread of readmission rates between DHBs was erratic, however one outlier had recorded a 100% rate of readmission. Throughout the audit, OAG staff met with many people who are doing the best they can to provide the best mental health support services they can, despite obstacles and hurdles. But the challenges were not new and improvements were needed urgently. In my view, the Ministry of Health and District Health Boards need to urgently make demonstrable improvements to deliver better results for people with acute mental health problems. The OAG has recommended DHBs urgently find ways for inpatient and community health teams to work more closely together, to prepare and implement discharge plans, and inform adequately all patients, relevant family members and carers. Tools and systems to support the quality discharge of patients needed to be upgraded and staff helped to use them. Regular reviews of discharge planning needed to be carried out, and both DHBs and the ministry had to improve on the way they use their information to support patients in the community. Health Minister Jonathan Coleman said the report made some concerning findings. But this is a snapshot from 14 months ago, and the Ministry of Health has been working ever since, with DHBs, in light of the findings that have been communicated by the OAG, so there have been measures taken. The Health Quality and Safety Commission has launched an initiative around discharge planning, and it's important that the findings in the audit are addressed. There had been a massive increase in demand, and in the provision of services, but at the same time, waiting times have actually come down over that period, and that's a point that's often lost, Coleman said. A delegation of ministry officials, including Director and Chief Advisor of Mental Health Dr. David Crawshaw, appeared in front of Parliament's Health Select Committee Wednesday morning, speaking on a separate public petition for a mental health review. Committee said it was considering launching its own investigation into mental health services. In a politically loaded question, asked by Labour MP David Clark, over whether the ministry would have a problem with that, Crawshaw said that as a public servant, he served the government and Parliament of the day. He always welcomed further discussions and engagement on the issue. And in a letter to the Auditor General, Director General of Health Dr. Chai Chua said the ministry welcomed the report and a number of actions were already underway to improve services. Labour leader Andrew Little said the report was damning. What it tells you is it's a pretty disastrous experience for way too many patients. We have a mental health service at the acute end that is poorly resourced, is struggling to keep up, and the people paying the price for that are mental health patients and their families. It's just not good enough.